am so excited, grateful, and happy to see you all here today. My name is Amie Leigh. I am the Director of Public Health Initiatives at Somatic Experiencing International. I'm delighted to host this series and to be with you all today in what I think we know is a massively important mission critical issue for these times. Many of us have people in our lives who are medical practitioners, friends, family, colleagues. Many of the people who registered today are medical professionals. And many of you are therapeutic providers who work in some way with the medical profession, whether as clients or just resourcing on the team in some way. Some of you may be medical social workers. If you're wondering right now, is this session for me? Yes, this session is for you. We have made it for anyone who has the mental health of our frontline medical workers in the forefront of their mind and their practice these days. And you're going to love our lineup. From Dr. Russ and Aimie to Kathy and Mary Jane, we've got some incredible expertise coming to us who have some really excellent things to share. We know that the world can use as much mental health support as possible right now. So stay with us as the series continues monthly on the second Friday of every month at noon US Mountain Time. No further ado, I'd love to ask the panelists to please go ahead and turn on your video and join us here on the main stage. Drum roll. So folks, we could do the traditional. Tell us your bio, go through the standard. I don't mean to disregard anybody's need for formality, but I'd love to dive right into some deep content if you don't mind. I think the times are pressing, and I would love if you could let us get to know a little bit about who you are. Well, one, just thank you for being here. Thank you for how much you care about this issue and that you've chosen to be a part of this. And would you show us a little bit about that by answering the question, what is the most important issue in your view in mental health as it relates to medical professionals in these times?
My name is Dr. Russ Kennedy. I am a medical doctor. I was trained in neuroscience as well as developmental psychology. I burned out of medicine about 8 years ago, I guess, and my biggest feeling is that burnout is probably the biggest issue in mental health care today for doctors and nurses and paramedics and everybody who's in the health profession. It's been shown in medical school that every year empathy goes down by a little bit. Over the 4 years, we drop empathy. And I think it's because we get inundated with emotion. So burnout is one of those things that I think that we learn to give so much to other people that we really forget to really pay attention to ourselves. We really forget to pay that attention to that, the younger version of us that used to play, that used to have fun, that used to laugh all the time, that used to go swimming. The first thing that medical professions usually lose is their external, the things they do for fun. Our identity as doctors is so ingrained in us that that's the last thing typically when I talk to doctors who are burning out in my practice, which mostly surrounds anxiety. That's what I do now, is I'm an anxiety mentor. I'm not a medical doctor so much for anxiety anymore, but I'm a mentor for people who struggle with anxiety and burnout. So my big thing is to get people more connected to themselves. And I found no better way of doing that than through Hakomi, SE, different types of body-based practices. Now, my mother, there's a Freudian slip for you. My wife, I should just stop there for a second. My wife is an SEP. She specializes in pre-verbal trauma before age 7. And she deals with adults, but people have had trauma before the age of 7. So the house is always going back and forth with, I saw this client today who had presented with this. What do you think this is about? So we're always, regurgitating things together and working through things together to find out what the ultimate underlying cause is for people to be unhappy with their work or just in their lives. And it's usually an underlying disconnection from self. And I think that's what SE and a lot of the somatic therapies teach us, which is how to heal with yourself, how to connect with yourself. Because if you're connected with yourself, everything else just falls into place. If you're not connected with yourself, everything else goes to crap. So I'm Dr. Russ Kennedy. That's all I got to say about that. And I'm looking forward to what the other panelists have to say and taking questions.
Thanks, Dr. Russell. This is, I can totally relate to that. This is Mary Jane. I'm currently working at the Ottawa Hospital, the General Hospital right now, as I sit here. And I'm currently an SE student, and I'm a registered psychotherapist and also a certified spiritual care practitioner. And when you spoke about what matters most, and you're talking about burnout and fatigue, I can really relate with that. And a lot of, I find the hospital staff here and even patients is, I guess it's more grief, and clients and family, but I guess the staff, I would say it's more the compassion fatigue, seeing so much grief and so much hardship and um, through this whole pandemic, as Amie said, and just on the impacts of mental health and what that means. So I specialize with cancer patients. I'm a frontline worker, as I said before, and I also see COVID patients when there's a need. And so the hospital and very much holistic care, emotional, spiritual, physical, mental. So those are very important pieces. And just with the COVID and having patients isolated in their rooms so much, and being isolated from families, and just their emotional health is really, there's just so much to take in for them. And so also working with the spiritual piece and the cultural piece as well. So having like a very much an integrated holistic care. So that's a little bit about who I am. And so I work in a hospital, acute care, I work full time. And yeah, just if you have any questions, maybe surrounding what it's like to in hospitals at this time, in the third wave, um, feel free to ask, and how it's impacting mental health.
Thanks, Mary Jane. I'm Kathy Allan. I'm a registered nurse, and I used to teach in the Healing Touch program and also in another holistic nursing program. I'm board certified holistic nurse, but I am also a somatic experiencing practitioner. And what I've done is I've moved on from teaching Healing Touch, and I've developed a program called Trauma-Free Nursing. And I'm so aware of having worked in the hospital in practically every unit you can think of, about how nurses and doctors and other healthcare professionals are being traumatized on the job through the system, that the healthcare system that we have today can be very traumatizing. And, we talk about burnout and compassion fatigue, but I'm wondering if those are really cover words for abuse and exploitation, because we have people who are working 12 hours a day, short-staffed, not enough help, not enough PPE to protect themselves. And that's really quite abusive. How can you go home after a 12-hour shift and maybe an hour to get there, an hour to get home, and then get enough sleep, get the right kind of food? And many times staff doesn't have time to even go to the bathroom or take a break. So I felt like I needed to share my SE skills with hospital personnel to help them learn how they can interrupt the traumatic stress continuum. But that's only part of it. They need more tools to help themselves and to help their patients. And they also need to look at the system itself. We are not us versus them. We're good and the system is bad. We are part of the system. So I've developed in my programs a way of looking at our own behaviors and how does that contribute to our burnout and our exploitation, and then what can we do about it? And there are some really wonderful things that we can do about that and to change the system. So that's kind of where I'm coming from. And it's so important for us to that basic thing that needs to happen first is to interrupt that traumatic stress continuum to help our fellow caregivers. And then from there, then we can move forward into, developing policies and procedures to help our patients and to minimize traumatization in the hospital and other healthcare facilities, not just the hospital. So that's where I'm coming from.
Thank you, Kathy, Allan. I will jump in there now. And Amie, when you ask what are the most important mental health issues for medical health professionals these days, I agree with everything that has been said already, and I have a different perspective on it, being on the medicine side of things. And I came to this conclusion after my personal experience of adopting my son from the foster care system and expecting one thing and getting a very different situation. And what I learned was that there is this trauma from our early childhood that does form our nervous system. And with time, I realized that what we were kind of missing in medical training was understanding that everyone has some degree of trauma. There are things that happen in life, relationship dynamics, things that are very subtle at the time, but yet form these trauma patterns in our nervous system. And this goes on to affect everything, but specifically in this context of medical health professionals, it affects their stress tolerance. And when I look at the situations that medical health professionals are faced with these days, this is when that stress tolerance really comes out because we're pushed to the max. We, like Kathy was just saying, we're expected to go into a facility, a hospital, a clinic, whatever, and yet not be feeling safe because we're not either properly prepared or given the tools, given the protection that we need, and yet feeling this obligation, this responsibility, because we are health professionals, to put ourselves in danger in order to help other people. And like Dr. Russ was saying, the burnout is huge, partly because of that, and partly because as the pressures build on health professionals, and we're often asked to do things that we are in internal conflict with. We're not aligned with the way the system does things, or we're not aligned with particular things. And that creates this inner conflict that is an energy drainer. And then the grief comes out, and a lot of it is disguised grief with what we see happening, with what we see, perhaps patients being treated, or just kind of being caught up in the system and not getting the results that they know that they could achieve if we were only able to do this, but we can't do this because of insurance, or we can't do this because of lack of resources, whatever the case may be. But it's just this unresolved and disguised grief that starts to build up. And what I see happening on a biology level, again, like I'm coming from the perspective of medicine now, and what my journey has been is leaving conventional medicine and what actually was a 3-year training in general surgery. And once I started learning somatic experiencing and have also gone through that training and become a somatic experiencing practitioner, realizing how much of this influences our actual biology and our physiology and the adaptive mechanisms in our biology that happen. And so a person will, when they're stretched to the max, they will have not only these trauma patterns in their nervous system that hold them back and compromise their stress tolerance, but they actually have a biology that is compromising their nervous system and their stress tolerance. And whether that's mitochondria, whether that's inflammation, whether that's toxins, but then there's this accumulation of, again, life experiences stored in the nervous system and biological adaptive mechanisms that both are compromising their ability to handle stress and to tolerate maybe a level of stress that they used to, but now that is overwhelming. And so then that turns into poor sleep and coping mechanisms to manage those emotions, and they start to isolate from relationships, and it actually sets into play further traumatization in all of their life, leaving them feeling unsupported, alone, lost, and then you've got the perfect setup for burnout and perhaps even addictions in a medical health professional. So when I look at, like what the question is, the most important mental health issue is understanding this stress tolerance, this ability to handle stress is both a combination of life experiences and trauma that has been stored and the biological adaptive mechanisms that are compromising that stress tolerance.
So I just want to say that one of the good things that's happening is that the National Nurses United has a program which they're introducing things like SE through different programs. They're going into the physiological support that people need to recover from trauma. In the early years or the early times of the pandemic, the advice given to people who staff who are having a lot of stress was, well, what you need to do is you need to eat better, you need to get more rest, you need to exercise. And those are all positive things to do, but it didn't really get to the core problem. It didn't get to the biology, it didn't get to the physiology. And now what they're doing is they're understanding that, and more resources are becoming advertised for healthcare staff to take advantage of. Yeah. And I know, like you and Russ, you're seeing people privately. So are you getting a lot of healthcare people coming in?
I am. I find a lot of the time that a lot of us who went into healthcare, my father was schizophrenic and my mother was kind of a neurotic worrier. So the little joke I tell is my father was psychotic and my mother was neurotic. So my own psyche didn't stand much of a chance. So what I see in a lot of healthcare people is a lot of them were rescuers in their family. Like they were the oldest child. They were the ones that, if the parents weren't quite holding it together, they were the ones that had to pick up the slack, and they had to learn how to take care of other people. And then they got this inflation from mom or dad going, oh, you're such a great cook. You're such a great, you help so much around here. It becomes part of our identity. And then, we become healthcare providers, and then we're in a system that doesn't allow us to kind of, extend the way that we want to, or, to use an SE term, to complete that. I know it's a physical thing, but we want to complete that. We want to feel like we're helping. And then when you get stopped at every turn by the system or whatever, you have this old adaptive program that's in you, as Dr. Aimie was saying, that, this behavioral thing that's in us. And then we try and complete that and try and solve our problem that way, which is really just kind of a defensive accommodation, this over responsibility, right? So then when you block that defensive accommodation, people lose it. It's like, okay, you know what? I did this because I wanted to help people, and now you're stopping me from helping people. And that in and of itself is traumatic. It creates a separation from yourself because you really want to fulfill your role or your dharma or whatever you want to call it as a helper and a teacher and a therapist. But when you get blocked doing that, it's really, really difficult for people. And often it's a necessary thing that they have to go through to kind of realize, hey, how do I look after myself first? Like I said in my opening statement, but it's amazing how many doctors, how many surgeons had a parent with cancer? How many surgeons had a parent who they couldn't fix? So my dad was mentally ill, so I couldn't fix him. So I didn't go into psychiatry, but I branched off into neuroscience and mental health. And then I got frustrated in the system because I couldn't do what I wanted to do. So I really want to add that because it's the how we are made, like the first 6 weeks as our nervous system, the neural tube starts to develop. And then it's like the experiences in our lives. Because nobody goes to a nursery and goes, you know what, that baby over there, that's a narcissist baby. And that baby over there, that's a rescuer. It's the experiences in our lives. Our nervous system is set down by the experience in the womb in a lot of respects, but our experiences is what really nail those things together. And what SE, I think, does is kind of starts unhooking those old patterns and gets to the root of the problem, as opposed to what you were saying, Kathy, is just dealing with the superficial.
And what I've really noticed is that with medical professionals, there's so much pressure on us. There's, we're working long hours, like Mary Jane was saying, right? Like we're dealing with a lot of stuff on the job and not really having a lot of time for even sleep or the proper self-care, let alone therapy. And yet when people feel themselves approaching that breaking point, like you were saying, Dr. Russ, right? They're approaching that breaking point. They're looking for resources. What I found through my journey when I had my absolute health crash, right? Where my body could no longer keep up. My mind was trying to, but my body was just like, no, like we've reached max. We can't carry this burden at this level anymore. And we're not going to let you get out of bed. We're going to go into chronic fatigue and autoimmune stuff. And, you know, even some of the anxiety and depression and, you know, what I called my freeze response. And then it's like, well, okay, what can we do though as healthcare professionals to maximize our time to actually look for what will be the most effective strategies to work with this if we recognize that we have this. So I would love to hear from actually each of you, like what are some of the things that you see are the most effective, time efficient ways for healthcare professionals to actually start working on this. My personal opinion, of course, is that talk therapy was not it for me. And it's not what I recommend for other people because they go home, they talk about it, and it just brings stuff up without the resolution, without the completion of what needs to happen in the body, since it activated a survival response in the body. So Mary Jane, maybe we can start with you. And what are some of the things that you recommend to your colleagues that you see really struggling? And what are some time effective ways that they can start to work on this stuff?
Yeah, I was relating to each of you actually when you were speaking, just on especially that, for example, with Kathy, like, you know, as a healthcare professional, they say eat, they say sleep, they say, you know, all these ways to do self-care. And then as Dr. Russell was saying, like, well, he's having a lot of clients who are, you know, frontline workers. And it's just kind of like, I guess we see so much during the day that it just almost becomes normal for us. But what I've done to kind of help is, because I'm a SE student, is that I'm using my personal sessions that we need to get to kind of help me process it in my body.
I love that.
So, because like you say, Dr. Aimie, talking isn't working for me, or exercising, Kathy, isn't necessarily working for me. So it's just kind of like, and then it's kind of like, oh, well, once you process, it's kind of like you think everyone's got your kind of job, and you realize, well, actually this isn't normal. And you're kind of like, so, and then of course, it helps me to bring it to the patients that I work with as well, to allow them to resource and to find resources during this challenging time. So yeah, it's keeping your mental health during this crisis is you know, I think it's a #1 challenge for all of us.
Yeah. And I'm really awesome to hear that you're using your SE sessions for your personal work these days, because otherwise the tendency that I see both in myself before I started doing SE and in other healthcare professionals is coming home and just kind of crashing, zoning out, turning the TV on, getting a glass of wine, overeating, you know, and I see that as part of the freeze response, and just going back between like sympathetic at work and then freeze response and the collapse at home. That's not really helping the issue. Yeah. Kathy, Allan, what are you seeing with your nurses that you're working with?
Well, I did a talk recently. I'm a member of the American Holistic Nurses Association, and there was a small group that I did a talk to, and I did a presentation of a couple of techniques that they can use to reduce the amount of cortisol in their system and to get back in balance. And there were 9 nurses that were at that meeting, and they all got it. And they started talking among themselves. Now, none of them worked in the ICU, but they worked at the hospital. And they all wanted to go up and volunteer at the ICU and in the ER to do these techniques on their colleagues, because they knew how burned out they were. And they said that these nurses in the ICU and in the ER are saying that they don't feel anything. They're not distressed. They're just numb. They just don't feel anything. So you know they're in the freeze. You know they've gone too far. And the problem, I think, unless they get some kind of intervention, a lot of them are leaving the profession
Well, this is the burnout that Dr. Russ was talking about.
Right, exactly, exactly. So it's a good thing that that we're having this conversation. And Amie, I see that you're on here. Maybe you have a question from somebody?
Yeah. So your conversation is so rich. This is really helpful. I see there's one person in the chat, Carolyn, who identified herself as an RN earlier, is relating with a lot of what you're saying. And so thank you. You're already providing a resource for us, which those of us who know, who study somatic experiencing, we talk a lot about different kinds of resourcing we can get, whether it's from a physical practice, which maybe at one point you guys can lead us through some exercises, but also just this knowledge and this shared humanity that you all are not like, wow, like being inside your worlds is really privileged. But what you're talking about with burnout right there, it really speaks to the question that just got a couple of votes up, and that's from Summer.
So I'm just curious, I really related with Kathy's comment about, self-compassion, burnout and things like that, not necessarily being endorsed. And I found that, when new practitioners come into the field and they're, they've been trained to advocate for themselves, they have this self-awareness, maybe through SE or other modalities, and then they push back, then their job can get threatened. So I'm just wondering, you've shared your stories about burnout. What recommendations do you have for people who want to stay in the medical field or in helping profession, but still want to maintain their job security while they're pushing back?
I think that's a really good question, Summer, and thank you for being brave enough to come up and ask that. Go for it, Kathy.
Oh, I was just going to say that as far as nurses go, you can sign a form that says that you cannot take this assignment because you feel like it's unsafe. And that's like unsafe for the patient, but also unsafe for you as the practitioner, that you may feel overwhelmed and that could cause a mistake. And that's the last thing that you want to have happen. So there are things that you can do. You can talk with your supervisor, talk with the other nurses there and find out, how they handle things. But it's important for you to maintain your integrity and to set boundaries when you know that something is dangerous. Because when you don't do that, that creates a moral wound where you're practicing in a way that is not correct. And then you live with that moral wound. And it can mean that there could be harm to the patient, or maybe there's no harm to the patient, but there's a lot of harm to you.
And one thing, Summer, that I've noticed in working with a team of people at the hospital and nurses is that when you do such a thing, like Kathy is suggesting, even with that, there can be a lot of stuff that comes up in your body as you recognize that what are other people going to think of me doing that? What is their response going to be if I sign a form saying I'm not willing to do that? Are they going to think that I'm shirking my responsibility? And are they going to see me as being difficult? Right. And so then here's all this other stuff that is really an internal stress on you. And this is where, for me, like a lot of the somatic exercises can become really helpful in just lowering the intensity of that to bring yourself back to a place of calm, clarity, which when I'm in those types of situations helps me make a decision in terms of, are we at the point where I need to sign this form and kind of take that risk of my colleagues, a little bit of backlash from them, or am I not at that point? Right? Like being able to just make the decision about where you are at that point. So if it's okay with you, I'll show you one of the exercises that I do that helps me, if that would be helpful to you. Dr. Russ, you had actually brought up the burnout in the first place. While she's bringing up some people, did you want to add anything to what people can actually do?
It's so easy to get into victim physiology, especially if you get, like a hospital or administration or whatever. It's just so easy for us who are, helpers, healers, whatever you want to call it, to fall back into, oh, I must be wrong here. I must be wrong. And as soon as you fall into victim physiology, you emit that. And then people are more likely to victimize you even more. So it's really important to get grounded. And I think that's probably what you're going to do, Dr. Aimie, is just do a grounding exercise. When you feel that like insecurity, when you feel that feeling like being on your heels, because once we get into victim physiology, it's very hard to access our prefrontal cortex. It's very hard to access our true self that really wants to look up for ourselves, because so often in healthcare, doctors, nurses, everybody, we feel like there is this overlord that we have to operate within this particular boundary all the time. And it's really difficult not to kind of, after a while, just get so exasperated by that you automatically adopt this victim mentality. So what I tell people is just say to yourself, am I being a victim right now? And the other thing I do, which may not be exactly popular, is I tell people, get a little angry. Not a lot angry. You know, I'm not talking ragey, but I'm just talking, get a little angry, because what anger does is anger is there to protect you. And anger changes your physiology a little bit. So like I said, I'm not saying go, you know, start throwing stuff around the station, but I'm just saying, you know, just get into yourself, you know, put your hand on your chest, really feel yourself, and just bring up a time that made you a little angry. And it will change your physiology, and it will allow you, when you do decide to stick up for yourself, a more holistic feeling behind that. So thanks, Dr. Aimie. You can take us from here.
Sure, thank you. And I see, yeah, several people seem very ready and eager to do a somatic exercise. So for this one, I strongly recommend that you have some type of support against your back. It's not essential, but it is helpful for this exercise, particularly when we're dealing with overwhelm. Many of you may know this already, so forgive me if you already know this, but the back is one of those places in our body that really needs a felt sense of support for us to feel like we're out of that victim physiology that Dr. Russ was just talking about. So the back, the neck, the head, those are the places when, as an infant and a young child, that's where we received a lot of support, you know, when our parents would have been holding us. And so that's the same type of thing that we can do now. And when we're doing this exercise, that is really helpful. So I'm going to lean back in my chair a little bit so I can feel that support against my back as I'm doing this exercise. And go ahead and bring your hands up, put them as far up against your shoulders, your chest as you can. And I'm going to have you do this very, very slowly. So if you think you're doing this slow, I want you to go even slower. Okay. And really put some intention into this, meaning really feel what your arms are doing and how the muscles are engaging. And I want you to slowly start pushing away. And I want you to imagine pushing away the biggest boulder that's even bigger than you. It is so heavy, so big that that's how slow you are having to go right now. Your muscles are engaged. You're pushing, you're almost, you know, like pushing into your back because you need that extra strength to push this boulder away. Go as slow as you can with that intention of feeling that strength in your arms as you're pushing away. And when you do get all the way out, you can hold it there for a second with your arms fully extended. And then when you feel ready, you can just kind of lightly let your hands just come back into your lap. And I just had a deep spontaneous breath with that. Carolyn, I saw that too. I saw that deep spontaneous breath that you had with that movement. Isn't that interesting, right? Like we didn't have to go into a story. We didn't have to actually think about a particular thing that we were pushing away in our life, but just actually engaging those muscles. And since the nervous system is what runs our muscles, when we are working with our muscles, we're actually working directly with our nervous system. And just the movement of pushing things away and pushing things off of our chest gives us a little bit of space, a felt sense in our body of space that, I can breathe a little better, right? May not be 100%, but even if it's just a little bit better, a little more space, a little more room to breathe, a little even more room to make mistakes in our life, whatever we need a little more room for. This is my go-to exercise for when I feel myself kind of nearing burnout and overwhelm. Nope, we're going to push it away. And I even do, oh my goodness, I see that big yawn. That's awesome. That's another parasympathetic sign. Yep. A deep spontaneous breath or a yawn are both signs that we've shifted your system to more parasympathetic, which is where we want to be. I will even do the push, I call it the push away exercise in with the people that I work with. And we will even push things all around. So it's not just in front. It's, I'm going to push things up off of me. I'm going to push things off to the side. Like I am going to create all the space that my arms can reach so that in this space, in this moment, at least, I am safe. So Summer, I hope that is helpful. That's a very, again, quick, fast technique to quickly shift your body into a place of feeling just a little more safe, and you've got some space and less overwhelm and burnout.
Oh, I just want to add that sometimes when you're new, you don't really know who your other compatriots are. And so you give yourself time to find like-minded people who will support you. But I will say that I started working at one hospital years ago. I was there for 3 days and I realized that the level of care that they gave at that hospital was not something I wanted to sink to, because I thought they gave terrible care. So I quit and I found a hospital that gave really good care. And then I started working there. So that's always an option. But before you do that, it's good to see if you can meet more people who are really invested in giving good care. And sometimes they're not so obvious, but if you look around, you'll find them.
Yeah, something that struck me about that question as I guess when I think about it and as I do my own work on this, it's sometimes we have the tendency to override. So we're not necessarily listening to our body, but we're listening to our minds, and we're listening to many other different noise, right? But let's say, for example, you're not feeling well, but you override and you go to work anyway, or that's what I'm kind of getting at. So it's kind of like what's helped for me is to become more aware of my own nervous system and to actually listen to it, try anyway, and not necessarily the mind that's worried about everything, right? But often the body knows the truth, or the body does know the truth, and it's got a lot of wisdom, and to follow that when we're seeking self-care. So it might mean calling in sick. It might mean, I know for me, during the pandemic, I got increasingly difficult to go to work because there's this threat all the time in the hospital with COVID, and I was really close to having the vaccine, and I'd wait a year. And so it was almost like really hard to go see patients because I was wanted to get the vaccine and so I could be a bit safer, and I didn't want to like risk getting the COVID if it was so close to vaccine. So I took, every second Monday off and took a holiday, So it depends on your employer, but it's communication, transparency, but also listening to your body.
That's excellent. Thanks for the responses, everyone. And thank you, Summer, for kicking that off. Thank you, Carolyn, Amaryllis, and Bjorn for joining us in the cool exercise. We'll send y'all back to the panel, to the attendee side of the session. But I just really want to thank you for jumping in with us. And then what I want to also say is, I think you just raised a question that I've heard some other questions in other domains about, Mary Jane, which is specifically around the vaccine. And so I want to pose this question to you, and I'll pop out to give you space to answer. The question is about, as the vaccine is coming online in the United States, I'm hearing a lot of medical professionals having shifts in their stress level. And I think for a lot of civilians, myself, everyone's like, oh, yay, finally the vaccine, I can relax. And I'm imagining with nervous systems for medical professionals, that's different. It's like, oh, finally the vaccine, all these feelings I've been stuffing for a year may come to the surface. And I've been looking at that as maybe a traumatic upset, just from my recent experience in an ICU hospital. And I've shared this with you guys, but just to give some context, my uncle lost his life recently to COVID, and in that ICU, our family was allowed to come in, and that was extraordinary, really wonderful. But I did note that every doctor and every nurse also joined us because they were so happy to be with family who could be with their loved one at that moment. And also they all wept with us and they all prayed with us, which I know touched our families' hearts, but also in my thoughts about y'all, I thought this is extremely unusual behavior for doctors and nurses. And there's something shifting. So if you can speak to maybe the shift that's happening right now because of being at a year, having the vaccines, and what we could anticipate, how we might turn a different corner with that.
Yes, so the vaccine is a big question, and it's a huge stress relief once you get it, even just the first one. And there's a lot of unknowns of how much you're protected, right? Some say 70, and then it depends on the vaccine. So there's still a lot of unknowns about it. But I know in Canada, a lot of the frontline workers haven't been able to receive the second vaccine. And so it's been pushed back to July. So a lot of the other populations can get it first. So there's still that piece where we don't really feel completely protected. And I know for mine, and then there's the part where we might get the second one, but it might be pushed back. So yeah, there's just so much about the vaccine, but it definitely took a lot of weight off for many, many people. And yet with the variants and everything that's going on in Canada, there's still, and I noticed in the last 3 weeks that the stress level has really increased again, just because of the amount of people that are in the hospital. We are at capacity. We're at even 115% capacity. And so that makes it very stressful for everybody. So it's almost like a different stress.
So I was talking to some friends who are in hospitals, working in hospitals in San Diego, and they said that the capacity the amount of people who are hospitalized has really gone down, and it feels like the hospital is getting back to normal. And so that's a big relief for them. But as far as worrying about getting COVID, it's a very valid worry. And there was a study that just came out that said that they know that there were 3,600 healthcare providers that got COVID and died, and that these healthcare providers have not been tracked, so they feel like there's probably more. And so there's a big relief for the vaccine, and people starting to feel a little bit more protected, and grateful that their patients, people out in the public are getting the vaccine, and that the nurses are getting it, and the doctors and the other healthcare providers are getting it too. And one thing we don't mention so much, we talk about the doctors and nurses, but there's the housekeeping staff, and there's other support staff in the hospital that are being exposed. And so we have to keep them in mind also in our work.
Mm-hmm.
Yeah, one of the biggest problems I see is social media. So there's a bunch of people on social media saying the vaccine's a hoax, the virus is a hoax, and I think that fires up people's stress almost more than anything else.
Yeah.
Is because there's just such mistrust, and especially in the United States, and I don't want to slag the Americans, but it really is a dollars first society. People are felt like they don't matter. It's money that matters. So when you get a population of people that feel disenfranchised from their own, if you look at Sweden or Norway that have a great social contract with their people feel trusting of the government. But if you don't have a very good social contract with the government, of course you're going to mistrust everything. So anything that comes from authority, masks, vaccines, anything that would help slow the virus is now become a political issue, which is hugely increasing people's stress because they don't know what to think anymore. And it's the 10% of the people that are the most adamant against vaccines that are the most likely to post on social media. So it looks like 50-50, but really it's only about 10%. And I think that creates a huge amount of stress for people. So that's just what I want to say about that.
I think that the COVID has brought up just a lot of trauma in general on all sides. And like Dr. Russ is saying, the social media does not help for any of that. And many of the people who've been coming in, I even know nurses, even physicians who have had to go to the emergency room because they feel like they're having a heart attack because of the levels of anxiety. And that's just how their body presents that to them, especially if they're not really listening to their body, like Mary Jane was talking about earlier, right? It's going to come up somehow. And that usually then is in some type of physical symptom that can feel exactly like a heart attack. So that, even a friend of mine who is a physician, she thought she was having a heart attack and it ended up just being more anxiety. And the recommendation is stay off of social media, stay off of the news. That's not helping us stay in a calm, clear space to make decisions about, whether you do get the vaccine, whether you don't get the vaccine, whatever you think about it. It doesn't matter as much as, are you able to come from a calm, clear place that's in alignment with who you are, or are you feeding off of fear on either side? And even with the masks, I would say that has been a big issue for some of the medical health professionals, because even just physiologically, right, having to wear a mask for their 12-hour shifts or whatever it is, even though they know it's for their protection, there's also an adaptive mechanism that happens in the body that we need to be aware of, support our bodies with, so that we can be, following the compliance and the rules and be doing what's best to keep us safe and the patients safe while we're having to wear these masks that will change our physiology and can trigger a survival response in some people.
Well, one thing nice is that people like yourself and Russ, you're setting up private practices that are outside the box of traditional medical approach and leading the way for other healthcare professionals to get you're like a wonderful resource for them so they can get some help, know that they're not alone. So
well, I'm sure Dr. Russ will speak to this more, but the conventional model I have found does not really help. It's not actually addressing the root cause. And so it's not actually able to help. I saw a question come in about the use of antidepressants or other medications during this time and whether that would help or hinder this process. And there's no one answer for everyone, right? It really depends on where you are at and the level of function you feel that you have or have lost and need to regain that in order to kind of resume life responsibilities. But either way, whether you go for a medication now or you don't, it's still just getting back to that root cause and what's actually happening in the nervous system to address that. Dr. Russ, what are your thoughts?
Yeah, I mean, we don't have time in general practice. We got 7 to 10 minutes with a patient. And one of the things why I opened my own practice is that I have this kind of intuitive ability to see into people. So if someone would come into my office, I could see that she was sexually abused by an uncle from the time she was 7 till 12. Now I can't bring that up in 7 to 10 minutes. And same with the ACE study, when someone has significant trauma. And the other thing is, doctors, we're not trained in any kind of therapy. I mean, the psychiatrists are to some extent, but even them, they're leaning more towards the medication model. Mm-hmm. And so, it's kind of like what I say is it's looking kind of like you're looking for peanut butter in the hardware store when you're trying to get mental health from your family practitioner. Yeah, they're usually fairly friendly and open people, but they're not really trained in anything other than maybe CBT, which helps in the short term, but doesn't really get at the root problem. So the reason I opened my own kind of clinic is so I can spend 90 minutes with someone. I can go into their background, I can go into their birth, I can go into the traumatic events of their childhood, I can go into how that's affecting them now. And I think we all love ourselves. But what we do is we have these certain experiences in our lives that make us accumulate what I call jabs, which is self-judgment, alienation, blame, and shame. So we start doing these jabs to ourselves at 3, 4, and 5 years old. We carry on with that and we create all these blocks to loving and connecting with ourselves, so that when we are subjected to adult stress, we don't know how to deal with it, because we've been judging, abandoning, blaming and shaming ourselves for so long. We don't have a conduit into ourselves anymore. So that's what I teach. And I think that's the basis of SE, is teach getting a contained process, going over some of our traumas in our lives and sort of neutralizing them or integrating them, or whatever, Dan Siegel likes to talk about, is getting these disparate parts that are in our system and putting them back together in a functional whole. And that's why I love SE. I love, CBT too. I'm not against it, but I don't think people get better just from talk therapy. I mean, you can't heal a feeling problem, an unconscious feeling problem, with a conscious thinking solution. It just doesn't work.
And I like how you say, like, in those 7 to 10 minutes that a practitioner usually has with their patient, with their client, like, that's enough to just bring things up, and then, have them walk out dysregulated, right?
And there's no faster way of ending an interview than handing someone a prescription. Here you go. This is it. See you later.
That's one of the things I realized when I was taking the SE program, is that therapists have an hour to spend in a nice quiet office with somebody who was traumatized in the past. But healthcare workers don't have that luxury. They don't have the time, they don't have the quiet place, and people are being traumatized in the present moment. And so that's why I developed trauma-free nursing, because we have to look at not only the individual and give them the tools to stop the traumatization, but also to look at the system and what we can do to change the system. Because the system wasn't always like this. As you can see from my white hair, I've been around for many years. And when I first got out of nursing school, it was lovely. It was so lovely. And we didn't have the pressures that people are under today to make that almighty buck, to make it profitable for the system. So anyway, yeah. So we need to look at ways that we can, in our system, develop new policies and procedures to prevent the traumatization of our patients and prevent the traumatization of ourselves. And like Mary Jane, you're actively working in a hospital right now, and I know you probably see a lot of that.
Yeah, it's interesting you say that, Kathy, because I know, the allied health team, like the PTs, the OTs, the nurses, the physicians, you're right, they don't have necessarily time to provide that time that they need with the patient. But fortunately, that's part of what I do, right? So I'm a registered psychotherapist and I work for the spiritual care department. We provide emotional and spiritual support. So I can actually spend the time that I need with the patient and helping them to work things through, right? So if I was to give you an example, I went into a COVID-19 room this week, and this person was very angry and very disappointed. She had received a major surgery and at a local hospital, and she spent 3 weeks in the hospital, and then she went home, and she had her birthday and she had family outside, and then she came down with COVID. Yeah. And most likely she thinks she got it at the hospital, and I'm pretty sure she would have, since there was an outbreak there. Mm-hmm. So she was very, very upset. And what I did with her, I said, I'm really sorry that happened. And she's like, you're the first one who's actually showed you care. I really care. And just said, that should not have happened. Not defending the hospital, no, that should not have happened, and it was almost like things changed after that for her, So, but what an awful story, right? Like, what a terrible thing, she's got major comorbidities, and now she's got this, and now she's worried about whether the family got it at the party, even though they were outdoors, and you know, her husband's already got lots going on with COPD and like all these worries, and all she has is her phone and this isolated room, and people are scared to go in and out, you know. So just what people are living, you know, and that's part of that compassion fatigue, right? That people we live with because we hear these stories, right? And so, yeah, I don't know if that helps answer your question, but
Well, I think that one thing that is really valuable for you, Mary Jane, is that having that somatic experiencing background now, you're able to bring that into your work, even without letting people know that this is actually what you're doing, right? And as we were talking about, how do we as healthcare professionals actually make that connection with the people around us, whether it's our colleagues or our patients, I find that being able to use somatic experiencing helps me connect with them so much faster. It actually helps me save time when normally it would take me so many minutes to make that connection with them through just talking. When I'm able to bring in somatic experiencing into that experience with them, I'm able to help their nervous system relax and have that level of feeling heard and understood much faster. So a lot of what I find myself doing and how I just naturally implement this with both my coworkers, especially my nurses who are much more on the front lines than I am necessarily, right? They're more at the bedside than I am for longer periods of time with each patient. But even with the patients, is I do make sure that I'm never across from them so that it's me against them. I'm always positioning myself so that it's us two, like I'm side by side with them, or angled so that it's us against whatever the enemy is. You know, if COVID is the enemy, then it's us two against the enemy, rather than it being you and me and we're sitting across from each other, especially if there's a desk between us. Like there's nothing that can kill connection than in that type of position. And I bring in a lot of touch. And I think with bringing in touch, you have to be very careful, of course. And so I always ask permission first. You know, can I touch you here on your leg? Can I touch you here on your shoulder? Is it okay with you if I you know, hug you? And even just with asking permission, right? That puts them into a position of empowerment and out of that victim place that is really helpful, even in just their disease process. And being able to feel like I do have some sense of control over my body, over my life, which a lot of people lose that, especially when they come into the hospital or the nurses are being overworked and they feel that loss of control. There are so many ways that just through asking them permission and that touch, you know, a hug across the shoulders, those types of things that can be so helpful in just feeling like, someone sees me, someone sees the level of stress that I'm having. And being able to make that connection through somatic experiencing helps me as a healthcare professional save so much more time.
So I just want to say real briefly that what you're both doing is stimulating the ventral vagus, which
Absolutely.
is part of the polyvagal theory.
Yep.
And when you stimulate the ventral vagus, you stimulate the parasympathetic.
Exactly.
People can start the healing process. And that's all I want to say. And so Amie, take it away.
I love that. I get called Dr. Amie in this one. Somehow I got a promotion being here with you, Amie. This is a fun one. I'll do a workshop with you anytime. But also, I mean, really, I want to, like, what you're saying is helping me really see practical solutions, and you're helping me see the path forward. And also, I think you all are also sharing with us a lot of the upset and the pain and the agony. I just want to name that, like, I'm present to the complaint and frustration and stress in wanting to transform the industry, transform hospitals. And I don't think you're alone in feeling that way. So it helps people on the call who are not in medical establishments get a little bit more sense of your worldview. So thanks for giving us your worldview on one hand. And also thank you for giving us some practical strategies of how to support people moving out of that, like into a space of some ventral vagal healing and all that. And really got a lot of that exercise earlier. I know Dr. Russ says he'd like to lead us through an exercise, which someone in the Q&A put out there that they loved some of Kathy Kane's exercises, and he thought he might give us a try on it. Dr. Russ, you feel up for one?
Yeah, sure. Yeah.
Okay, so if you guys would like to come on screen to be able to do an exercise, go ahead and use the raise hand feature on your screen, and we'll start transporting a couple of you over. And while that is happening, I'm just going to take a moment to say, and I should have said this earlier, but I'm so enthralled that we do this as 100% free programming. Here's your NPR commercial. This is 100% free programming because we are a charitable nonprofit institution and we need your community support. So I would please invite you to look in the Q&A. Kiana, who works with us on our public health staff, is going to put in there a link that you could click through and you could donate right now. You could donate $5, you could donate $20. You could donate something that says that this material is worthwhile for you and that really communicates something strong to us that this is helpful. And so if you are in an international place, you can click on www.traumahealing.org/donate, or if you are domestic US, pull out your little cell phone, send a text message to the number, wait for it, 26989, that says support SE, all is one word, SUPPORT-SE, and that will also take you to the donate screen. For those of you who are medical professionals who don't know about this, somatic experiencing was established as a modality essentially kind of early on to support therapists and related one-on-one practitioners in their practice. But we have a lot of alternative medical providers, naturopaths, acupuncturists, we have massage therapists, we have dance providers, yoga teachers. And in my first SE class, there was a doctor. I remember she was an Indian woman, and she said at the end of our 4-day training, SE has ruined my life. She said, I'm an American woman, she's an American citizen, native born in India. Her family's from India, excuse me. And she said, I have been always raised to be the top of my class, the most excellent authority in all things. I went to medical school, did a very powerful residency. I am now a doctor who has had to practice authority over people's bodies. And now in SE, I'm learning how to support them from the bottom up. She said, in just 4 days at this beginning of this 3-year training, you've transformed my relationship to my career forever, and perhaps you've even ruined it. We will enhance your world, just like Dr. Russ is about to enhance us with this exercise.
Sure. So this is one of Kathy Kane's exercises, and please do, as an aside, support SE. It's really helpful. As a medical doctor, it really has given me such a sense of fulfillment, rather than just sort of dealing with the nuts and bolts of people's complaints, to really connect with someone, which is why I did medicine in the first place. So I would really encourage you to sort of support us in our role. I know as a medical doctor, it can seem kind of out there. And believe me, sometimes I talk about this stuff, I feel like I want to have a seizure, because it is like this it's so antithetical to the way I was practiced. I was taught how to practice. So with this is called objecting without contracting. And usually what I'll get people to do is if you're sitting, if you can slip your shoes off, just slip them off. If you have to untie them, don't bother. Just put your feet flat on the ground. Let your shoulders drop, let your jaw relax. And then cross your hands across the midline and touch your cheek on each side and just sort of massage your cheek. Make sure your hands are washed from COVID. That's all right. And then just feel this, because if you look at it from a neuroscience point of view, our brain has the most real estate for our hands and our face. So as soon as you cross the midline and you touch your cheeks, the opposite cheeks with your hands, your brain has to pay attention. Your brain has to come into the sensation of the present moment. So this is a really good grounding exercise. It looks a bit funny, you know, you don't want to be doing this at the Safeway or the grocery store, but when if you're feeling, you know, out of sorts, it's a nice way of bringing yourself back into sensation, because from that present moment sensation, we can start changing things. We can't change things when we're hooked into the future and our future worries, what if, you know, warnings and worst case scenarios. So just let your jaw relax, let your shoulders relax, and pick something that has troubled you in the last couple of days. Don't pick the worst thing that's happened, but pick something that troubles you in the last couple of days. And just feel how your body tends to want to contract around that. Could be an argument with your spouse or something at work, but just feel your body, how it wants to kind of just squeeze around that. Because when we squeeze around something, we actually hold it tighter. But if we can just let our shoulders drop, let our jaw relax, and just object, just be aware of the fact that I don't like this, but my body doesn't have to contract around it. Because like I say, when you contract around something, all you do is hold it tighter. So what this does is it allows this negative feeling to run through you as opposed to being trapped and caught in there. And if you can add to this, putting your hand on your chest, like over your heart, and then putting your other hand on top of it, and just really feeling like a compassionate, caring connection to yourself. Like you're really just trying to connect with yourself. That usually will help neutralize some of the negative experience that you have around that particular situation. And the next time that you have that situation, it's less likely to drive you into a kind of a sympathetic kind of overreaction, because you can do this multiple times a day. You can train yourself to just object to something without contracting. And it's amazing how freeing this is, because so often we think of things that bother us and we go, "Ugh!" But it's just an awareness of the role your body plays in just keeping your mind hyper vigilant on the negativity. So just take a nice deep breath and let it out. And just remember, objecting without contracting. And that's by Kathy Kane. She's one of the sort of bigwigs in SE. I watch over my wife's shoulder all the time. So my wife's an SEP, and so she's always watching her videos, and I'm always sort of looking at my book and then kind of looking over and watching her stuff. And she'll look over and go, "Hey," it's like, "Yeah, I'm digging this stuff. This is pretty cool." And I think she's on here. Cynthia, I think you're on here. So I love you, honey.
I love something. Thanks, everybody. Thank you, Charlotte. Thank you, Cynthia. We'll change your roles back to attendees. It's wonderful to see each other doing this together. It's unmistakably important that we realize we're part of a whole community. So let me ask you, as we move towards closing, if you're watching this after the fact on YouTube, you will be able to notice them underneath where we post the video. Something else I want you to go and do watch this video afterwards on YouTube, because you'll have more contact information on how to follow up with each one of these people who were on here. You'll see cool things like, Dr. Russ, I'm sorry I forgot your book. It's at the Airbnb. Anxiety RX is an awesome book. When I first met him, he shared it with me that he wrote, it's a new prescription for anxiety relief from the doctor who created it. And it's completely relevant to this conversation. It's on Amazon. You can definitely go ahead and check that out and get that for yourself. It's called Anxiety RX. And Dr. Aimie, I didn't necessarily run by you that I'd be sharing this, but she is putting together a whole summit of powerful speakers on the biology of trauma. And so you're going to hear so much more on this and so much deeper. And so stay tuned. You put that in your search results. I think it's coming up in July, around July 19th to 25th, if I'm not mistaken.
That's right.
Yep. So underneath the YouTube, we'll put the links of how you can get more information about that. And then Kathy is working on her new programs that she spoke about earlier, right? You said you're working now on trauma-free nursing. So you can look up Kathy Allan and trauma-free nursing, see her new website. Mary Jane, we will be posting how people can get in touch with you afterwards as well, if they can follow up with you, if you do any individual or one-on-one support work. So I want to thank each of you and really just highlight that you've taken your understanding of, it was Dr. Amy's word, neurooptimization. Like, what a cool idea. We optimize everything, but how do we optimize our internal experience of how we exist at the level of our nervous system? We've talked around it. We've given you a little bit of access. There's so much more available. And so we'll just stay in your queue as a resource for that. As we close out, I want to invite you each to say, what is a resource that you would think is a really good resource that you would refer to anyone in the medical profession if they said, I really need a resource right now. I'm at the end. I mean, we know about the Dr. Lorna Breen Heroes Foundation for the medical providers who are committing suicide at alarming rates. SOS, we need resources more than anything. Could you close us out and point us in some directions for help?
I will start us off. I would say that for resources, I think that what has been the opportunity with COVID is that there are so many more resources online than there ever was before. Meetings have gone online for my work with the addiction medicine. All of the 12-step meetings are so much more available online. It's not the same as in person, But at the same time, there's more opportunity to attend more meetings, because you can attend meetings anywhere in the world at whatever time you need a meeting. There's so many more communities building around whatever specific challenge you are facing. And so I would encourage you to kind of hone in on, like, what is the specific challenge that you have, whether you are a social worker or a nurse or a physician. Like, you'll each have your unique challenge. You can identify those. You can be much more strategic about finding the exact resource that you need for what you are going through.
So I would like to say that people can go to the National Alliance for Mental Illness, and on their website, they have a list of resources to help people who are really traumatized. And number one on the list is Therapy Aid, which was started by one of our SEPs and has volunteer SEPs to help frontline workers. There's 4 more organizations that are offering either free or low cost therapy for people who need it. And then there's a list of 5 organizations that are peer support groups that people can go to. So that's a wonderful resource for people, and they can choose whichever one feels like it's the right one for them.
I know for me, my workplace offers a lot of resources. And so if your workplace does, don't be afraid to reach out. You know, sometimes we think, oh, well, you know, it'll get better, or it's not that bad. Sometimes you know, there's a lot of resources out there, and accept the help. So I guess that's and look into what your employer offers. Often they do offer free psychotherapy for people who are frontliners. So I just invite you just to check that out and accept the help.
Yeah, and that's really important, because I know we as healthcare workers think that we're supermen or superwomen, and we don't accept help. And like I was saying earlier, a lot of us developed this complex when we were younger of over responsibility for other people. And it's really, you know, your relationship with other people can be no better than your relationship with yourself. So it's one of the things I would suggest is Clubhouse. It's a new social media app. There's doctors groups on there, and you can share, you know, your struggles. And I think it's just so important to be heard these days. If you do have some childhood wounding in your past, I would definitely recommend my book, Anxiety RX, because it goes through my own struggles as a mental health provider and being able to come back and create a career that I love. You know, I was a doctor for 25 years, and it's taken me now, you know, in my life to actually develop a career that I really, really love. And it's really just important to find what you love. Look what you did as a teenager for fun. Did you play guitar? Did you sing? Did you paint? Did you dance? And start doing that again. Play is so important. Play is massively important because it takes us back to that childhood state where neuroplasticity and brain-derived neural growth factor really start to come up in our system. And that's what we need to make change. It's so hard to make change when you're already exhausted. So what I would say in closing is just learn how to give it to yourself first, and then you'll be much better at giving it to other people. So thanks to Amie, thanks to SE, thanks to Cynthia for showing up. And yeah, I'm grateful for the opportunity to talk about this.
Some of you may have seen, we sent out a lot of notices about scope at one point in the very beginning of the pandemic. Working with a team of 17 plus neuropsychologists, we developed this resource by taking the big SE trauma resolution model, and we tried to adapt it in a bite-sized adapted SE protocol model that could be used for crisis stabilization for, well, specifically, actually, Kathy was on our original work group. We had a handful of emergency responders, including EMS who were in 9/11. We had doctors from the West Coast and naturopaths. We had all kinds of emergency responders on that. And we wanted to take the big SE and we wanted to get it into quick bite-sized pieces that could go in the pocket or the badge of a nurse, like Mary Jane's got her badge on, that it could go in there as a resource of something you could do for a quick body reset. Kiana dropped it in the chat, www.traumahealing.org/scope, SCOPE. And those exercises, while looking seemingly very simple, really do a lot to bring the sympathetic and the sympathetic back online into the window of resilience, into a zone where you can be functioning more like yourself despite the external circumstances being what they are. And we really did it like, how can they do it in 5 minutes going from a bed to a nurse's station? So it was designed to be a 5-minute tool. But kind of like what has already been said here, if you were to take our crisis stabilization that we're launching later on this year program, it might be easier for you to learn a trauma method to care for other people. I'm sure all of us who've been through SE training know this. While you're learning SE and you're thinking, this is going to enhance my practice, this is great, the secret special sauce behind the scenes is you're like, I am so much better now. Like it really gives you so much resource for yourself so that you have something to give. So do please look us up some more. This really wasn't intended to be a big SE commercial, but my goodness, you guys are really that. I get how it's transformed your world. So thank you so much, Kathy, Mary Jane, Russ, Amy. What a session. Thank you to Marv Tuttle, our executive director, for letting us do this, for our board of directors who've just said, let's keep providing resources and learning how. Thank you for all the participants who've come and the work that you're all doing in your world that you care so much to want to continue to get more. We just really, if there's something we can do to support you, or if you have a desire to speak on one of these in the future and you think you have something, worthwhile, the link to the Speakers Bureau is also in that Q&A. And we'd love to know about you. In May, we'll be doing something around parenting and children and COVID and all the sort of transitions we're in at that time. In June, at the SE conference, look out, we'll be doing an SE community conversation, hopefully with a group in person on community building. We're getting back there. So stay tuned. We always have exciting things. You can get on our newsletter to learn more. You can donate at www.traumahealing.org/donate. And just thank you for being you. I wish you peace and wellness and restoration, access to all that you are and all that you're becoming and all that you're up to in the world, that you could be powerful and feel empowered to help others through these incredibly turbulent times. Thanks all. I wish you a wonderful day, and we will see you again sometime in the future. Bye-bye.